We are privileged to welcome Dr. Yogesh Niturkar, a distinguished and accomplished professional in the field of homeopathy, with an MD in Homeopathic Materia Medica from the prestigious Dr. M.L. Dhavle Institute. Dr. Niturkar has dedicated over 18 years to the practice and teaching of classical homeopathy. As a lecturer at VK Homeopathic Medical College and Hospital, Latur, he has inspired and guided countless students in the field of organon of medicine and philosophy. Dr. Yogesh Niturkar is a passionate educator, an acclaimed researcher, and a compassionate practitioner whose multifaceted contributions have enriched the field of homeopathy. It is an honor to have him with us today. Thank you, Dr. Yogesh.
Thank you for a warm introduction. With due respect to VP and SS ma'am, we can feel the substantial energy because of both these pioneering ladies, because of whom we are all together here. So my topic is a retrospective study on viral bronchitis. As Asrani sir had covered in general about the way in which these diseases are very common. So some background information about this study. As most of you might be aware or may not be aware that in 1992, Latur and Dharashiv district had hit with an earthquake where massive disaster had taken place, and because of that the education system was also spoiled. So rehabilitation was one of the thing of these school children. So to fulfill the educational needs of the earthquake affected village children, the school was started named as Janakalyan Nivasi Vidyalaya under RSS Janakalyan Samiti. Since 2007, I passed out in 2006. I am from the first batch of MLD MHI, and after that the seeds that were rooted within me, it sprouted in the form of taking a role of health educator as well as the honorary physician in the school health mission program. So I had received a phone call from the school in charge about that the school children are having continuous cough. All are coughing very badly and it becomes worse at night. Due to coughing, all are awake throughout the night, and we had given them allopathic treatment, but it is not working. Annual exams are also going on and we don't know what to do, what has to be done, and do we have any medicine? So I just said yes, we can do something, and I visited the school. So as it is a retrospective study, we can have these objectives. The objective of this study was to study and evaluate the role of homeopathic medicines in school children that were suffering from this acute viral bronchitis. And the secondary objective that I had in this study was to understand the presentation of disease, its role in selecting the individual remedy. Along with that, how we can play an important role in communicable diseases where the exciting as well as maintaining factors act together. It was one of the way in which we can understand the practical application of Dake's proposition given in Stewart Prose. So the type of study, or we can say the design of study and materials and methods, it is a retrospective cohort study where the common characteristics that we had taken was of acute viral bronchitis and school children. The method of collection of data was screening with a special school health screening sheet, and the sample size is 69 school children. So total 69 school children were there which had been screened on the special screening sheet, and all the data was recorded. As I was fresh from the W Institute, so most of the things were on the back of my mind. So I had done the recording as per the homeopathic and research guidelines. Follow-up was taken after 3 days and on 5th day of homeopathic treatment, and allopathic medications were stopped at the onset of homeopathic intervention. So school-going children from 5th to 10th standard, because the school caters only education from 5th to 10th, and exclusion criteria was nothing as such at that time. So all cases were recorded on the screening sheet, symptoms were recorded in LSMC format, analysis of symptoms was done as per the nature, intensity, onset, duration, progress and frequency of complaints. Further sheet was analyzed in the form of classification of disease, susceptibility, sensitivity and the thermal status. Totality of symptom was built as per the presentation, and you can see the repertory also in the image where manual repertorization was done, and the selection of remedy was done on that basis of repertorization. The choice of dose, as per the guidelines, we had done susceptibility, intensity, nature, stage, and duration of disease. So overall, the practical aspects that we can see in such type of diseases like cause, maintaining factors, symptoms, signs, data processing, and the management part in terms of remedial and non-remedial. Just an overview of this cause and maintaining factors. All of us are aware about the reasons. I will just focus upon the maintaining factors that were there at that time. Staying together in a group, classroom as well as in hostel, waking up at 5 a.m. as it is a RSS school, so they have to wake up at 5 a.m. and it was they were having cold water bath and the oily food in hostel. So the result we can see in terms of acute viral bronchitis and the communicable diseases. So this was the presentation of disease in general. After analysis, I had found that how the disease has evolved over a period of time. So the understanding can be from that point of view, at nose level, at throat, lower respiratory tract, and the bronchi. Modalities are also there, and the concomitants were also in few of the cases. So this is the in way how the cases were evolved over a period of time. I am not going to narrate the symptomatology. It is just a way of how research aptitude can be built up in us in our day-to-day practice also. When we are approaching some nearby school, and school is one of the, like it is an ocean, we can have n number of various types of diseases from school. So these are the objective findings that we are having in positive as well as the negative findings. So this was the thing. The next thing that I would like to focus upon, the strategy that I had taken. Screening was the first thing, processing of that screening sheet in terms of assessment of symptoms and signs, disease diagnosis, classification of disease, analysis and evaluation of symptoms, susceptibility, how we can arrive at totality of symptoms, repertorization, remedial differentiation, remedy selection, posology, and the follow-up. So this was the thing that we had planned, I had planned at that time, so that the whole cases can be understood. Now what about the observations and results? This is the demographical data where we can understand the 69 cases, which are out of that 57 are male and 12 are female. So percentage is also given. Along with that, the table itself is called as the frequency distribution table of gender ratio of school children. Then we can see the frequency distribution table of class-wise distribution. So we can see the 5th standard students are maximum, 30 students were there, 6th, then the proportion goes down. So 5th and 6th have the major proportion. Now after studying the whole cases, it was found that as I had given the whole LSMC format and the evolution of disease, I was able to find out that the miasm, as all of us are aware, that in acute cases, the exciting miasm is SORA, latent SORA that we can see. So in 10 cases, where the cases were lingering, so psychosis was there. In 9 cases, I was able to find out that the tubercular miasm was the dominant in the cases. So the susceptibility was assessed from that point of view also. So where we are able to find out 15 cases had high susceptibility, 54 had moderate, and there was no record for low susceptibility. As the number of slides was going on, so I just restricted the simple bar chart in one slide, so that at least we should be aware that the data can be presented in different formats. So the 34 cases were having thermal status as hot, 14 had chilly, and ambithermal were 21. Potency selection, as I had mentioned earlier, in terms of the susceptibility, accordingly 15 had high susceptibility, so 1M was given, 54 had moderate, so 200 potency was prescribed. And the pattern of repetition of dose, I had given at that time 15 students in TDS form and 54 in QDS, considering the susceptibility status. So these are the homeopathic remedies that came in most of the cases. So LMCPA in 2 cases, alphabetical order I had arranged the data. LMCPA in 2 cases, Arsalbin 10, Bryonia 7, Calicarbin 3. Merxol was the highest one, 21, and the second highest, and phosphorus in 1, and Pulsatilla being the leading one. So what kind of mathematical understanding to reduce the number of slides again, because my reviewers were worried about the number of slides. I might be the highest slide owner in this whole sessions. Sorry as well as thank you for that. So I had combined all remedies, the understanding, because unless and until we don't have the understanding of materia medica, it is difficult to practice. So while repertorizing which were the things when I had reviewed, that was noted down, and the indications that were there, and it was a lengthy case taking, all 69 cases that were screened. So allium zipa, arsal, so materia medica understanding is going along with that, and the percentage is also given, that how homeopathy was useful in what percentage, in what proportion in communicable diseases. So the ancillary measures were there for the school management. He is the principal of the school, and the lady sitting is the hostel warden. So for school management, to change timetable of waking up at 5 AM for few days, most of the time we forget about the ancillary measures, and it is one of the crucial part where we can help these students or these our patients from falling prey to the such type of maintaining factors. So to change the timetable of waking up, then to stop cold water bath and to provide hot water for bathing, to guide canteen cooks for using less oil in food, and to have ventilation in the class and hostel rooms also. So these were the guidelines. For children, to cover mouth while coughing and to lie down in upright supine position, so that when the cough is aggravated, they can have some comfort. So this was the chronology of follow-up criteria. We are able to see physical generals, concomitants, particulars, and the objective findings. So appetite, thirst, salivation, dryness, weakness, body ache, headache, lacrimation, coryza, throat complaints, cough, chest pain, breathlessness, fever, and the on-examination finding. And the evaluation of the follow-up was done in terms of intensity, duration, frequency, subjective relief, and the objective findings. So the outcome assessment criteria was defined, that which cases we will say that these are recovered, and which are the cases where they are showing the signs of improvement. So recovered cases were those where the sense of well-being was there, disappearance of the signs and symptoms, and it was correlated with on-examination findings. And the improved cases, we can see sense of well-being is there, but there is partial disappearance of signs and symptoms, status quo of few of the signs and symptoms, and again it was correlated with the on-examination findings. Now what kind of effects of intervention were there? So response to homeopathic treatment at the end of 3 days. Status recovered or improved, and the cured. So two categories. Number of cases that were shown signs of improvement were 20. That is to say that 28% of cases showed signs of improvement on the 3rd day of follow-up. Cured, 49 number of cases, that is to say 72% of cases showed cure, so total 69. So homeopathic medicines were continued with increased potency or repetition of doses to achieve ultimate cure in 20 cases. So what we did, we either changed the potency and the doses also. So let's see what has happened. At the end of the 5 days, all 69 cases were cured. So if we try to understand in nutshell, so this is the summary that already I had mentioned. So the most commonly used remedies were pulsatilla, Murxol, and Arsal. After 3 days of homeopathic treatment, assessment of all 16 cases were done as per the assessment criteria, in which it was observed that 28% of cases showed signs of recovery, that is to say improvement, and 49 cases, 72% of cases were cured. 20 cases were continued with the same medicine with increased repetition for 2 more days, and it was observed that all the 20 cases were cured. As in allopathy also we see that after 3 days of antibiotics, some cases may require 5 days or some cases may require 7 days. So similarly, we also had the pattern of prescription where the susceptibility is not satisfied with what we have prescribed at that moment. So what conclusion and learning we can derive from the whole 69 cases? That homeopathic medicines are having significant role in the management of acute viral bronchitis. Presentation of disease is having its influence in selecting the individual acute remedy. dealing with maintaining factors by advising ancillary measures along with the homeopathic treatment plays a significant role in the prognosis of cure. Homeopathy is effective in acute viral bronchitis where there is resistance to the allopathic mode of treatment. Homeopathy can play a major role in communicable diseases where the cause and maintaining factors act together. So this is the screening sheet that was made for the screening. Being an MLD, MHI alumni, screening sheets are always ready with us. So it was easy to carry all the screening sheet with some modification, and indirectly MLD, MHI makes us MSCIT certified word file maker also, and we are passionate about that. So the thing is in front of you. Yeah. So as a homeopathic physician, can we approach to our nearby schools for exploring problems in school children? That is the question that all of us should ponder upon. Can we explore the role of homeopathy in community medicine in general and school health program in particular? Can we evoke research interest in medical students through school health programs? So all these three questions should be as a take-home message where we can at least start some screening of nearby school children, and it is dire need of the time. Most of the cases are undiagnosed, it is just a thing that we can explore. Sky is the limit for that, and homeopathy can play a major role in that. So these are the references, and thank you.
Thank you. Thank you, Dr. Yogesh, for this excellent research presentation.